Thank you, Mr. Chairman and Ranking Member Blumenthal. Mr. Secretary, we've all heard about the bureaucracy and inefficiencies in the system, and that's certainly not any secret. Throughout your modernization, veterans' abilities to receive care must remain unaffected. What protections are you implementing to ensure continuity of care throughout the VA RISE process?
I think that's been the whole focus, Senator, is to what we're doing is designed to not interfere except in that care, but actually make it better. And we've seen this as we go along. I can think of ways over this past year using best medical interest where we've actually cut out a layer of the bureaucracy, making sure that people can get to community care quicker. We've actually, aligned our women's health into where now they do not have to go back through their primary care doctor to get to their normal women's health needs of gynecological obstetric care. They can go straight there. So this is the kind of things that we're working on. I would be happy to let our Undersecretary deal with that just a little bit more.
Yeah, Senator, I think you've seen the organizational chart that we've shared with the staff. And as you look at that, you'll see the bottom part of the chart, which is the medical centers. We're not making any organizational change structure in the middle part, or in the bottom part. All of the changes are at the policy and at the VISN middle part level. We're trying to get the structure aligned. We're working to get the structure aligned so that the information flow to the facilities and to support the facilities is at the facility level. And we have policy offices right now that at the policy level do policy implementation and execution. And what we need to do is to get them out of the execution business and let the facilities do the execution. And we just provide them the standardization and the right and left boundaries in order to execute. So that's how we're mitigating the risk relative to the facilities, because we're not making significant changes at the facility down level. Everything is up, and how do we add additional support to the facilities? And Greg, I'll ask you if you have anything.
Yeah, if I can add one more thing, Senator. My background in process improvement has always told me that the best people that understand the way to improve things are the people actually doing the work. So the number one priority through this reorganization is to make sure that direct care is not impacted for our veterans and their families. The number one way to make sure that doesn't happen is to take input perpetually from the people actually doing the work, frontline clinicians, in addition to our frontline executive leaders. They have been engaged on this change from the beginning. And moving forward, nothing will happen with this reorg without their input and without understanding how any changes that we are projecting to make will ultimately impact the reality for the veterans and their families in the facilities. They will be involved every step of the way until we get to the finish line.
Very good.
And sir, if I could add on to that, the development of this plan was from VISN leaders. The VISN leaders are the ones who worked to develop this plan. This was based on the people who running our organization from the ground up, and they got input as they developed it over a 9-month process. It was an iterative process, and they engaged with outside expertise as well as our own internal consultants that we have within VHA.
Very good. With Senator Murray's help and Senator Collins, them leading us forward, we're about to wrap up the appropriation cycle, and which is really remarkable. Almost immediately, we'll begin again. Do you currently have the necessary funding authorities to execute VA RISE, or is it going to need some additional help in that regard?
Senator, yes, we do. And we're looking ahead for our fiscal 26 budget. We appreciate the numbers that have been given to us. We appreciate Senator Murray, you, and others in the Four Corners. We've had these discussions. We had some discussions early on concerning some transfer issues, which I think we worked out. And I do appreciate the Appropriations Committee's concern there, and it was taken to heart on our concern. We are currently allocated at fiscal year 26 community care appropriations at $50,174,000,000. We are budgeting to that, and we do believe that we'll be able to make that. And also, we appreciate the input that we got from the Four Corners on other information there as well.
Good. Very quickly, I just want to mention that I had the opportunity to go to Fayetteville, Arkansas the other day at Patriot Park, and we have a lot of challenges that we're working through, but we always have to remember there's a lot of good things going on in regard to to veterans and people just stepping up. This is a great public-private partnership that's come together that is going to offer very affordable housing for our veterans and should be completed in the next few months. And hopefully we'll get you out there, Mr. Secretary, and maybe some of the rest of you to really see a project that we can all be very, very proud of. Thank you.
Look forward
Mr.
to it.
Chairman. Thank you.